So I'm delighted to be able to report to everyone about our work. We've had a really busy 18 months. So first of all, I'd like to draw your attention to our new brochure, really. It's our impact report, which tells everyone about the work we're doing, and you can access this online as well as ask for a hard copy. Our national awarding organisation, Ofqual regulated, has 50,000 students a year through 700 centres. Last year we developed a new qualification, Level 2 in improving the public's health. Why is that important to us? Well, we think that improving and increasing capacity and capability across the system is one of the major roles of the Royal Society for Public Health. We produce a number of wonderful reports with the wider workforce. One, Going the Distance, worked with health professionals, exercise professionals, looking at their role they could play. We developed the first register in the UK of healthy living pharmacies. 9,000 of these pharmacies who can provide really broad services in the community. We look too at how can the wider workforce really measure their own impact. So we produced with Public Health England everyday interactions, and that allows you as a healthcare professional at every level to look at how you can improve health and well-being. And a really big move forward for the organisation has been the development of an emergency services hub on our website. This means that firefighters, ambulance service and the police have access to materials, information, learning packs, toolkits, and the very best practice across the nation. Have a look online at our report, Life on Debt Row. For the first time, we understand the really profound implications of debt. What we want to do is improve facilities and options for people who now have to rely on this terrible lines of credit. In 2015, we produced Health on the High Street, which was our really seminal report on the environment and what it's like to live in a really unhealthy environment. To look at that again, we've been supported, I'm very pleased to say, by the Robert Wood Johnson Foundation from the USA, who have funded us to do the same report, Health on the High Street 2018, to adapt our findings and our understandings so that this concept can be taken and adapted for the USA. We did a really interesting piece of work with the Gulbenkian Foundation this year, and our report, That Age-Old Question, looks at the importance and the effect of ageism and attitudes to age. And I have no doubt that we will be following this up. At the other end of the scale, we have continued our work with young health champions. And our young health champions helped us through our very important and most media-loved report, Status of Mind, which looks at social media and its impact on young people's mental health and well-being. The report itself became a subject of great dialogue so that we could open up this subject. And so the Royal Society for Public Health has now set up an all-party parliamentary group for social media and young people's mental health to really bring a new idea to the fore. We introduced Scroll-Free September. An important part is that we get the idea out to the public that we need to really rethink and rebalance our relationship with social media. And related to that, promoting mental well-being has been a focus of the year. Connect 5 is our program which can help prevent mental health problems arising and can help build confidence and resilience. We have been training over 200 trainers to go out into communities and in workplaces to do this important training. Health and Wellbeing Awards have grown and grown in impact, and Here we are in 2018 in October. This month we will be hosting 350 people to a gala evening, and we will be showcasing the very best that's happening in local communities around the UK. So I hope you'll have a tour around the website. Thank you for listening. Hope to see you, be in touch over the year.